Hello, everyone. I'm Madhura, and on behalf of SAIA, South Asian IBD Alliance, I'm delighted to welcome you to this video that's part of our Gastro Gyan Ask the Experts series. Gyan means knowledge, and this series of short educational videos brings together a number of clinician experts to answer some of the common questions that we have as patients. So today we discuss a fan favorite question, which is how to manage nutrition and IBD. And to address this, we have with us Dr. Maitreyi Raman, who's really an expert in this area. Dr. Raman, would you like to kindly introduce yourself?
Thank you, Madhura, and thanks to SAIA for inviting me to participate in this conversation today. So I'm Maitreyi Raman. I'm a gastroenterologist and physician nutrition specialist, as well as clinician scientist at the University of Calgary in Canada. I investigate the role of diet and nutrition on the gut microbiome, as well as the brain-gut axis in patients living with inflammatory bowel diseases.
Awesome. So let's dive right in, Dr. Raman. So the first question that I have for you is this. Basically, there's a lot of advice out there about what kind of food you should be eating with IBD, what kind of food you shouldn't be eating with IBD. Is there one set diet for IBD? How do I know what food suits me and what food doesn't? And is my traditional diet, the ghar ka khana, the wheat sapad, is safe for me with IBD?
Okay, these are fantastic questions, Madhura, and I agree. My patients also tell me that diet and nutrition is a top and important question for their understanding of living with the disease. So I would say a lot of our understanding and learnings about diet and IBD have evolved just in the last 5 to 10 years. Prior to this last decade, we really did not pay too much attention about diet and its involvement in IBD. When we first look at large prospective cohort studies, we see very consistently that there are some dietary risk factors for new onset IBD, and these consistently appear to be high sugar containing foods, as well as high fat containing foods, particularly saturated fats and animal related fats. Other risk factors for developing new onset IBD include lower intake of dietary fiber sources. So people that eat lower amounts of plant-based foods, fruits, vegetables, legumes, grains also have a higher risk of developing IBD. So historically, there are validated and well-documented dietary risk factors for developing IBD. But when you ask, is there specifically one set diet for IBD? The answer to that is no. So there have been a variety of dietary interventions that have been studied in patients who have been diagnosed with IBD, so post-IBD. And these studies have evaluated whether adopting a new dietary pattern can improve gut inflammation and improve symptoms and change the natural history of IBD. And we see that there are several dietary interventions that have the potential and hold the promise of influencing the natural history, but there is no one set diet for managing IBD.
Thank you so much, Dr. Raman. That's really very helpful. And if I could just kind of follow up on that, how do I know what food I should be avoiding? Because you discussed the role of high saturated oils, animal fat, and so on as potentially triggering IBD. Are these foods I should completely remove from my diet as an IBD patient?
Okay, so we have developed and published an IBD food pyramid. So similar to a variety of different food patterns, the My Plate in the US, for example, in Canada, we have the Canada's Food Guide, for example. In that similar vein of thought, we have developed an IBD food guide specifically for IBD patients. And what we have recommended is that on a daily basis, one should have a very liberal intake of multicolored fruits and vegetables. And this is because the rich colors in items like spinach or green leafy vegetables or bright colored blueberries, for example, they have polyphenols, which have the potential to be able to modify the microbiome and treat inflammation. So we encourage lots of those with limited intake on animal-based products, high sugar foods, as well as foods that don't really have any nutrients, like artificial foods such as ultra-processed foods and foods with food additives that come in pre-packaging type materials.
Thank you so much. That's really helpful. And, as a patient, my key takeaway is eat as balanced a diet as possible. And for instance, with some of the foods that you mentioned, sometimes I find it hard to digest some of the green leafy vegetables. So one thing that's come up in patient support groups, like SAIA's IBD Desi support group, which has helped me a lot, is to change the texture of the food. So maybe that's blending it, cooking it really well, having it as what we call kadasal, which is like a mashed kind of spinach, might be options to integrate these foods into our diet so that we're not losing out on these essential nutrients that have anti-inflammatory properties. Thank you so much for going into that. And Dr. Raman, the other thing that you mentioned was dietary interventions, right? So are there dietary treatments for IBD, and can dietary treatments replace medicines or be tried in place of medication?
Okay, so I've heard two questions there. So first, how do we use diet? First, are there dietary interventions? And second, can they be used to replace medications? So I will start off by saying I would never recommend we utilize diet to replace medications. So if your doctor has recommended you to start on a medication, absolutely that needs to be the priority. But dietary interventions can be used to support medications to help achieve a better outcome. Now, as you know, Crohn's disease and ulcerative colitis, they're very heterogeneous conditions. They're not one condition. So what I mean by heterogeneous, some people may have mild disease, others may have moderate, others may have severe, they may have strictures, and so on. So now in patients with mild to moderate disease, very potentially in that very specific subgroup of patients, dietary interventions may be considered as monotherapy, meaning that is their sole source of intervention without medications. But you have to discuss that with your doctor to ensure that is the appropriate method and avenue for you. Now, regardless of whether you're using diet as monotherapy, meaning on its own, or in combination with medications, there are a few dietary patterns that have been validated. The first and foremost, as recommended by our guidelines, would be what we would refer to as the Mediterranean diet. And the Mediterranean diet pattern has been demonstrated to maintain remission in people that already have achieved remission through medications or other measures. And it has also been validated to help induce remission. So in people that have active disease, it can support in improving that disease activity. So Mediterranean diet is one option. Now, we think Mediterranean diet classically as, and again, there's no one definition of the Mediterranean diet, so I want to make that very clear. But the basic principles of the Mediterranean diet absolutely can be extended to the South Asian or Indian diet. There's a lot of similarities, but we just call it by different names. And the similarities lie in rich plant-based food priorities, rich intake of olive oil as opposed to other sources of oil. This may be a source of difference in terms of the dietary pattern between Mediterranean diet versus South Asian diet, as well as increasing intake of resistant starchy foods. So sweet potatoes, plantains, for example, all really good options to support gut health. Where I will absolutely make a comment is that we have seen the rates of IBD expand hugely into geographic populations which were previously underrepresented with IBD, South Asian being one such cohort. And we've seen that there are Western dietary principles that have crept into the Indian diet. So Western diet it's been associated with so many adverse health-related effects, including IBD. So maintaining principles based in that Mediterranean diet while decreasing elements from the Western diet, ultra-processed foods, added sugars, added salt, all of these things are supportive. Now, there is another dietary pattern called the Crohn's disease exclusion diet, otherwise known, or I'll call it CDED for short. And the Crohn's disease exclusion diet shares some principles with the Mediterranean diet indeed. It focuses more on excluding specific items that are known to be harmful to gut inflammation. And usually the Crohn's disease exclusion diet, when studied in research trials, has been used together with partial enteral nutrition or nutrient supplements. And the largest body of evidence to support the Crohn's disease exclusion diet has been completed in pediatric populations, so in children under the age of 18. But indeed, there are adult studies supporting its benefit as well. So I think CDED is a very reasonable diet with lots of good evidence to support its use in mild to moderate disease. And there are other dietary patterns as well, but the only other one that I'll choose to discuss today, just for the interest of time, would be the specific carbohydrate diet. And this too has evidence in both children as well as in adults. This diet, I personally find a little bit more challenging to teach to patients and for patients to implement because it does focus a little bit more on excluding foods to a greater degree than the other two diets. There may be a risk of nutrient deficiencies also with the specific carbohydrate diet approach. So if one wants to go in that direction, it absolutely needs to be done so under the guidance of a registered or health dietitian or health professional like a gastroenterologist. There are other dietary patterns as well, but maybe out of scope for the conversation today.
Awesome. Thank you so much, Dr. Raman. That was super helpful to go into. And I will just add, as somebody who's benefited tremendously from enteral nutrition, both exclusively as well as partial enteral nutrition with foods like what you discussed under the scope of the CDED. These are very beneficial treatment options, but they may not be a replacement for your medication. So it's very important to have this conversation openly with your gastroenterologist and make sure that you have the support of a registered dietitian on board to help you through these dietary interventions as well. And the focus really is do not exclude, see what you can add into your diet. Thank you so much for taking the time today, Dr. Raman, and answering our questions. This was so enormously valuable, and I can keep listening to you, I think, for an hour. And thank you to our lovely audience for tuning in. Do check out our other videos in the Gastro Gyan series, and we hope that this helps you through your IBD journey.